Alex, and I'll be your nurse practitioner today. How are you doing?
Good.
Good. We're going to be doing your physical assessment. The first thing I need to do is for you to stand up. Don't look at me. And just put your hands down to your side and close your eyes. We're going to check your balance, see if any swaying or anything. Okay, looks good. Now we're going to see how your gait is. Just walk, head, toe, heel, toe, heel. Okay, looks good. Just come back the other way. Okay, good. And next thing we're going to do is do your range of motion on your ankles, knees, and your hips. So just move your ankles around. Okay, bend your knee and leg out, down. Then do your other leg. There you go. Out, down. Okay, good. Now if you could just turn around for me, I'm going to look at your spine. I'm going to see how your posture is. Okay, good. Your shoulders are symmetric here. Okay, if you could bend down for me. I'm going to look at your spine. Make sure it's straight. Okay. And if you could raise up for me. All right, bend side to side. All right, looks good. Okay, now if you could just sit down here on the table. I'm going to check your head and your face. Make sure everything looks symmetrical. Eyes and ears here. Looks good. Look at her skin texture. Look at her hair texture and see if she has any hair alopecia or dry, brittle hair. Also feel her scalp for any lesions or lumps or anything. Okay, looks good. The next thing that we're going to look at is her ears. I'm going to inspect her ears and make sure they're symmetric. They are. And look on the outside of her ears and just inspect them. They look good, no drainage or any type of infection. Next, I'm going to get the otoscope and look in the ears. And first, I'm just looking in her canals. And then I'm going to be looking down in her ear with the otoscope to look at her tympanic membrane. It should be pearly white, like a grayish white, with no bulging or redness or anything. I don't see any bulging on that side. Okay, looks good. And then just palpate them. Any pain with that? Good. Okay. Next, I'm going to look at her nose, see if she has make sure it's aligned and make sure she doesn't have any deviated septum. And check and look in her nose to see if there's any type of polyps in her nose. Make sure she has good patency. She can breathe out on both sides. Make sure her mucosa is nice and pink and no any type of ulcerations or anything. Okay, looks good. Next, we're going to look at her eyes, look at her eyelids and her eyebrows and her eyelashes. I don't see any type of conjunctivitis or anything. And next I'm going to look at her retina and I'm going to look down in her conjunctiva. It looks pink, it doesn't look irritated. I'm going to check for her pupillary response and accommodation in her eyes. Just see if she has good pupillary reflexes. Pupillary response. Okay, looks good. Next, I'm going to check for extraocular eye movement. And I'll just have her sit right here, so I can check her from the side. And I just need her to follow my finger. Okay. good, and that's checking for the cranial nerves, I think 4, 6, and 9. Next, she just needs to cover up one eye. And can you see my hands moving or straight?
Moving. Straight.
Alright, cover up your other eye and keep your head straight.
Moving. Straight.
Alright, good. Okay. Next, I'll be looking in her eyes, doing an ophthalmic exam. I don't really have the ophthalmic thing, but I want to be using this today. I'm going to be looking at her funda and in her eyes to see exactly what I see. And when I'm looking for any type of abnormalities. And I'll be looking at her retina, and I'll be looking for a normal disc that has clear margins, that's kind of creamy yellowish to pink colored. I don't want to see any type of hemorrhaging of the arteries or veins in her eyes. I do not want to see any type of papilledema, which just shows increased cranial pressure, or the blood vessels, if they're broken, shows hypertension. So I want a good clear margin, oval rounded retina. Plus I also want the ocular disc to be its lateral besides anyway, we'll look at that some more. Okay, so now that I've looked at your eyes and your nose and I'm gonna look in your mouth. I'm gonna look at your lips to see if you have any cracked lips. I do not see anything. Okay, open up your mouth, please. I'm looking at her oral pharynx in the back, her gums, her teeth, everything looks pink. I don't see any lesions. Can you stick out your tongue? Okay, good. Move it side to side. Good. Also, her tonsils look good. Her uvula is midline. No exudate on her tonsils. No sores on her hard palate or soft palate. Can you lift up your tongue? Okay, it looks good under her tongue. Her teeth are white, no missing teeth. Do you have any problems with your teeth? Okay. Yeah, all right, the next thing that we're going to do is look at her neck. I'm going to make sure it's symmetric. Feel for any lumps or anything in her neck. I don't feel any. Feel for her carotid pulses, one at a time. I also need to listen for her carotid pulses. Make sure I don't hear any grooves or drills. Okay, now I need to also feel for her trachea, see if it's midline, and then can you swallow? Okay, and then feel her thyroid. I don't feel any type of lumps or nodules on her thyroid, so that's good. Okay, I'm going to check her lymph nodes. I'm going to start here and check her occipital lymph nodes, and then her post-auricular and her preocular, and then her tonsillar lymph nodes, and submandible, and the submental, and the superficial lymph nodes, and the deep lymph nodes, the supraclavicular lymph nodes, and then the infraclavicular lymph nodes down through here, and the axillary nodes are under the arms. And I'm doing a circle around motion. I think she's a little ticklish. Okay. Now that we've checked for her lymph nodes, and I'm going to be going to her lungs. So if she could sit up here for me, And just take some deep breaths for me. Okay. She's got good air movement in her lungs. She's not using any type of accessory muscles. Her respirations are normal, non-labored. Her color's good. Now we're just going to listen to her lung sounds. Deep breath. And then you also listen posteriorly too, bilaterally. You compare it each side. Deep breath. Okay, and after listening, I didn't hear any type of adventitious sounds in her lungs. Lungs were clear and all low, good air movement. If I were to hear some lung sounds that were abnormal, there's some tests that I can do on her. There's like there's called an respiratory excursion test that I can do, and that's a type of palpation or a type of percussion where I'll check her diaphragm movement. Also, and if her diaphragm isn't working as well, then you will have less excursion. Also, tactile fremetis has to do with palpation. I put my hands on both sides of her bilaterally, and she says 99. And if it's increased sound or increased vibration, that shows consolidation. Of decrease or increased or decreased will show whether she has fluid or consolidation. Also, another test she can do, auscultation, is a ergo symphony test. I believe that's how you say it. It's where you listen when she's saying all or e's, and you're also listening for increased sounds with that shows problems with possible pneumothorax or fluid in the lungs. So those are a few tests that you can do if you did hear abnormal breath sounds. Okay, after listening to her lungs, we're going to go ahead and move on. Let's see. Let's go ahead and look at her. Just look at her chest and just make sure. Look at her clavicle. Make sure she doesn't have any type of lesions or anything, and she doesn't. And I already checked the lymph nodes, and just take a deep breath. Okay, and if you can turn around, I'm just going to check her posteriorly. Just looking at her spine, looking at her scapula. Compare them, looks good. Her posture looks good. You can tell she stands up straight. And that looks good. So if you can just have a seat down, I'm going to listen to your heart. I'm going to look for any heaves, thrills, and I do not see anything. At the PMI, sometimes you can see the heart beating there, but I don't see anything at this point. So I don't feel anything or see anything. So next I'm going to listen for her heart sounds. The first place to listen is the aortic, and then around the aortic area. There's 5 main points: the aortic, then pulmonic, and then Erb's point, and then the tricuspid and the mitral. All those areas around valves, and the mitral valve area is actually is the PMI, and this is where you oscillate the heart rate. This is where you can hear that. So first, we're just going to listen to all these areas. Here's the PMI, the mitral area, and now get our heart rate. It's kind of beating fast. Okay. After that, I'll also listen to all those heart sounds. The next thing that we're going to do is look at her stomach. Okay, if you could just lay down for me, Hannah. I'm going to look at her abdomen. It's kind of an old crickety table. Just getting started. Okay, first I'm going to look at her abdomen and look for any type of movement or dimpling or pulsation in her stomach. That looks good. I don't see anything. So next I'm going to listen to her valve sounds in all 4 quadrants. Okay, her valve sounds. I'm also going to listen for her aortic artery and her renal arteries, to see if I hear any thrills or breathes, which I don't, which that's a good thing. Okay, since listen to those, the next thing I'm going to do is I'm going to do a light palpation. Okay, didn't feel anything. The next thing I'm going to do is do a deeper palpation. And I'm going to feel for her aorta pulse. Okay, and everything looks good. And while she's laying here, I'm going to feel her femoral pulses. Feel good, and I don't feel any type of lymph nodes in the femoral area. Okay. And if I wanted to, I could also listen for any type of graze in her femoral arteries. But she's pretty healthy, so no problems there. Okay, you can sit up for me. And okay, now we're just going to look at your arms. Check out her arms and hands and look at the colors of them and her shoulders. Can you flex your arms for me? Okay, good. And we'll look at her nails and her skin, her capillary refill. Looks good. And I'm going to check her strength and push down. Okay. Push up. Good. Okay, squeeze my hands. Good. Also, I need to check her strength on her neck. I forgot to do that. If she can push over, gets my hand. Good. This way. Good. Push down. Good. Okay. So it looks like she's got a good movement and strength. And let's see your muscles in your arms. And just flex those. Yeah, strong. Okay. Upper extremities. Now we're going to check for her reflexes in her arms. So the first thing we're going to do, since I don't have a hammer, we're going to use this. There's 3 areas where you want to check the reflexes that I'm aware of. The first one is brachial radial one, and you hit like right in this area, like an inch above the radius pulse here. Okay, got a good reflex. Then we're going to do the brachial. brachial pulse. All right. And then we're going to do the tricep reflex. And then you do it on both arms. But okay. All right. I think I hit her funny bone. Okay. All right, they look good. So, upper extremity's good. She's got a good muscle tone, good skin coloration. Next, we're going to check her lower extremities. If you could lay flat again for me, just for 1 second. Okay. Put your legs out straight and lift your legs up. Good. Lift your other leg up. Good. And we're going to check for her pulses. Her posterior pedis pulse. Okay, good. Sorry. And posterior tibial. Good. Okay. And we just take her look for capillary refill on her toes. Looks good. Okay. And next we need to check her reflexes. So if you could just turn back around towards the front. Got it? Okay. I'm gonna check I'm gonna check her patellar reflex. Okay. Then we're gonna check the Achilles reflex. Alright, looks good. Then we're going to do the Babinski, which is we just run an object over the sole of the feet from the heel to the front toes. Okay. Alright. And it looks like all her reflexes are good. And it looks like she's got good muscle tone, but we'll check her. Alright, can you hold your leg up, push down? Okay. Push down. Alright, good. And we're going to check we need to check the strength in her arms. We need her shoulders. Oh, okay. And you move your arms and shoulders good for me? Range of motion in your arms and shoulders? Okay, we already did the hips earlier. Alright. And I think that's about it. Let me just double check and see if there's anything I forgot. When I'm looking in the ears, I need to make sure I look for the bones, the incus, or any deformities. On the eyes, when I do the ophthalmic exam, I need to look for an oval or round disc with clear margins in yellow, creamish, and pink color. And the cup should be a small depression lateral to the disc center. There should be no hemorrhaging in the veins. Let me see, what else? Did we shrug her shoulders? We forgot to get her to shrug her shoulders. Okay, that's also supposed to check the cranial nerve 9 to shrug the shoulders, so we did that, and we checked the cranial nerve 12 by sticking the tongue out. Let's see. And on the lungs, where respiratory excursion has to do with the diaphragm and percussion, and you do it bilaterally. And you exhale and hold your breath in and percuss, and then you do it again on both sides. Tactile phremesis is palpation, where you feel the vibration both sides, say in 99. Decreased feeling is bronchial obstruction or pneumothorax emphysema or consolidation. Increases fluid. And then ecphony or whispered pectoral liquid is auscultation. And you say E or ah, and it's louder over the consolidated areas. And then diaphragmatic excursion is a type of percussion that can, when When the descent is limited, it suggests emphysema, ascites, or tumors, or you could possibly even have this with severe pain, such as with a fractured rib. Chest and lungs. We looked at all the lymph nodes. Oh, also, when we're supposed to palpate the abdomen, forgot to palpate the left costal margin where the spleen is, and the right costal margin where the liver is. So I will show you where that is. Okay. When you're palpating the abdomen, you're supposed to palpate on the right side here. Here's the costal margin, and you take a deep breath in, and then usually you can't feel the liver unless it's inflamed or any type of hepatitis or something, but that would be on the right side underneath the rib cage. And then the left costal margin is where you look for the spleen, and that's where you would find that. And you palpate it underneath that costal margin there on the left side. And let me just double check anything else. I believe that's it. Thank you.
Thanks.